How I get rid of my back pain with the help of telemedicine. Introduction: what is telemedicine? Telemedicine, also known as distance healthcare, is the use of technology to provide medical services or treatment to patients at a distance. The technology may include telecommunications, information technology, streaming media, radio frequency, infrared thermal imaging, and robotics. The pros and cons of telemedicine for back pain treatment. How do you choose the right solution? The use of telemedicine as a treatment for back pain is not a new concept. In fact, this treatment has been used for years now to treat those who suffer from back pain. There are many benefits to using telemedicine as a form of treatment for those with back pain. Some of these benefits include: patients can avoid the costs and inconvenience of traveling to a physical office visit, the convenience and privacy that patients experience at home. There are many disadvantages to using telemedicine as a form of treatment for those with back pain. The first disadvantage is that the video chat isn't as interactive as an in-person conversation. There are also concerns about confidentiality and HIPAA law compliance. The second disadvantage is that many doctors have a can't-do attitude when it comes to non-traditional treatments for their patients. The third disadvantage: patient may never get reimbursed for health insurance. Some health plans have a restriction on non-traditional treatments such as chiropractic, massage therapy, and other types of alternative medicine. If your health insurance carrier is one of these carriers, you could find yourself denied payment for the telemedicine consultations you need. Many times, these denials are without any explanation whatsoever. You should always check with your health insurance provider to make sure they do not have any restrictions on non-traditional treatments. How telemedicine helps patients with low back pain. There are a number of factors that play a role in the treatment of low back pain. Telemedicine is not just for people who live in rural areas or cannot afford to see a doctor in person. Telemedicine has been shown to be an effective tool for patients with low back pain, and it should be considered as an option by healthcare professionals if they have access to it. The use of technology can help out with diagnosing and treating low back pain remotely. Thereafter, the doctor can discuss and give advice over the phone or via email. Low back pain affects millions of people every year. The causes of this type of pain are often difficult to pinpoint. However, there are certain risk factors that are common in people who develop this type of pain. These include being overweight or obese, having a job that requires long hours of standing or sitting for long periods of time while using a computer or watching TV, having a stressful or a dull lifestyle. Having said all that, low back pain does not necessarily mean that something is wrong with your back. It could be caused by a number of different things. For example, it could be caused by muscle strains, spine problem, a herniated or ruptured disc, nerve entrapment, arthritis, spinal stenosis, infection, or tumors. Whatever the case may be, low back pain can become quite painful and disrupt your daily life. Conclusion and future outlook for telemedicine in the management of low back pain. Telemedicine in the management of low back pain is a relatively new technological innovation, but it has seen rising popularity in recent years. It can be used to provide support for patients with chronic pain, manage acute low back pain episodes, and to guide rehabilitation. Telemedicine has many benefits that can lead to reduced costs and improved outcomes for patients. This approach also reduces the need for costly treatments like surgery, which is an important consideration when considering the future outlook for telemedicine in the management of low back pain. Many researchers are studying how telemedicine can be used to diagnose and treat chronic conditions like arthritis or COPD in remote areas where resources are limited. Dr.Art Hit Hongban at MD Orthopedics.